This week, the governor of Michigan, Gretchen Whitmer, asked the White House for special help for Michigan. She asked the White House to help meet the surge in cases in her state with a new surge of vaccines to her state. In places where we have big surges in cases, raises this interesting question. Can we flood those zones with even more vaccines than they might otherwise get? I mean, it makes sense, right? At least in layman's terms, it makes sense in terms of trying to get around the epidemic, trying to get on the other side of it, for two main reasons, right? I mean, the risks of having tons of virus floating around, having tons of copious transmission anywhere in the country, it's the same as risks that we had even before we had vaccines, right? Copious transmission means people are getting sick and people are dying. With vaccines, that may be somewhat mitigated by the fact that older people are more likely to have vaccine-induced immunity now. But still, the same patterns that we saw, rise in cases, rise in hospitalizations, rise in deaths, it still holds. It's still happening. Also, though, now, more so than before, there's the additional risk of copious transmission anywhere in the country. With all the variants that are out there now, the more transmissible, more dangerous variants that are out there, right now with all the variants circulating, copious transmission anywhere in the country means more opportunity for the virus to mutate and to potentially defeat someday, vaccines and the therapies that are currently working against them. More transmission equals more reproduction of the virus equals more mutation of the virus, which means more circulation and potentially development of new virulent bad variants. So if you can surge vaccines to places that have upticks in cases, doesn't that make sense, right? Vaccinated people don't get infected, mostly, which means they help to stop the exponential spread. They also don't help the virus develop even more potentially dangerous mutations. They also don't get sick, and they don't have to go to the hospital, and they don't die. I mean, wherever we have, the vaccine rollout is going great. The vaccine rollout is exceeding expectations in considerable ways. Is it a reasonable case that Michigan is making that places that have tons of transmission, that places that have worrying surges of transmission ought to be prioritized for additional surges in vaccines? Joining us now is Dr. Peter Hotez. He's co-director of the Center for Vaccine Development at Texas Children's Hospital. He's also dean of the National School of Tropical Medicine at Baylor College of Medicine. Dr. Hotez, thank you so much for making time tonight.
Thanks so much for having me.
So I obviously am not a doctor and not an epidemiologist and not an expert in any of this. And so I just wanted to give you a chance to kind of set me straight. That's how I am. I just explained how I'm sort of feeling about this as an issue and what seems like a reasonable policy adaptation to consider. Is there some of this that I'm not understanding, or have I got any of this the wrong way around?
Well, Rachel, it's turned out you've learned a lot of epidemiology over the last 14 months. So that's a pretty good assessment, actually. I think a couple of things to think about. One, the major variant overwhelmingly in the U.S. is the B.1.1.7 variant, originally from the United Kingdom. Yes, we have the other variants from South Africa and Brazil here in the California variant, but the one that really is accelerating right now and the one that's keeping us all up at night is the B.1.1.7 variant. And that's likely accounting for the big rise in cases in Brazil, in Michigan, and it's also accounting for a lot of hospitalizations now among younger people. So this variant is more transmissible, it has higher mortality as well and higher hospitalization rates. The issue is the B.1.1.7 variant's not only in Michigan, it's across the upper Midwest, it's across New England, it's across New York and New Jersey, and it's here in Texas and Florida and Georgia in a big way. So the thinking is what's happening in Michigan now is probably a harbinger of things to come in the rest of the country very soon. That's one big issue. And the other is a lot of states are underperforming in terms of testing. So some of that variance may reflect the level of testing. For instance, in Kansas, the level of testing was recently reported to be quite low. So it might be far worse than we actually realize. And then there's the question of bandwidth. Even if we supply supplied more vaccine to Michigan, would they have the capacity to manage it and be able to vaccinate it? And it may be the case. So there may be some wiggle room in terms of supplying extra vaccine, but the bottom line is the B117 variant is just about getting everywhere now. We've got to accelerate and vaccinate the country as fast as possible. And by the way, this was all predicted and predictable. And I have to say the Biden administration did respond. If you remember, Rachel, back in January after the inauguration, they gave the 100 vaccinations and 100 million vaccinations in 100 days. And it was looking reasonable. But then we saw the rapid rise of the B117 variant, and the scientific community said to the Biden administration, including myself, hold on, this isn't going to work anymore, because now with the B117 variant, we have to vaccinate by the end of the spring. And they responded and they put in place a plan. So they are clearly very responsive to what's happening. In terms of the specifics for Michigan, it may make sense to supply some additional vaccine, but this is going to start going up in every state now until we can get to more than half the country vaccinated. And by the way, we're going to get there pretty soon. I think in 4 to 5 weeks, we're going to be in much better shape. It's a matter of how we navigate now the next 4 or 5 weeks.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.